Hello friends, today we will discuss about brachial plexus. This is a very important topic and a very important question. So let's discuss now. Brachial plexus. So this brachial plexus is nothing but a network of nerves which lies in the neck and axilla, and it is formed by the ventral rami of C5, C6, C7, C8 and T1 roots, and it gives rise to the nerves which innervate the upper limb. Now let's see the components of brachial plexus. See, this brachial plexus have roots, trunks, divisions, cords and branches. Now we will discuss it how these are formed. See, roots. These C5, C6, C7, C8 and T1, these are all the roots, and these roots forms the trunks. See, C5 and C6 both forms the superior trunk or the upper trunk, and the C7 forms the middle trunk, and C8 and T1 both forms the inferior or lower trunk. So in this way, this upper, middle and lower trunk forms by C5, C6, C7, C8 and T1 roots. Next, coming to divisions. These trunks further divides into anterior and posterior divisions. See, in this way, anterior, posterior, anterior, posterior, anterior and posterior. So these trunks divides into anterior and posterior divisions, and further these divisions forms the cords. So here see, these cords are formed by the upper trunk's anterior division and middle trunk's anterior division. These two forms a lateral cord, and here the lower trunk's anterior division forms the medial cord, but here the posterior cord is formed by the three posterior divisions of all the trunks. So it's very easy. See, the upper and middle trunk's anterior division forms the lateral cord, whereas the anterior division of lower cord forms the medial cord, and the all posterior divisions of three trunks form the posterior cord. Now let's see it in a line diagram. So this is C5, C6 which forms the upper trunk, C7 forms the middle trunk, C8 and lower trunk. Further, these are divided into anterior and posterior. So this blue portion is anterior and the orange portion is posterior divisions. See here, the anterior division of upper trunk and anterior division of middle trunks both forms the lateral cord, which is situated laterally, and here this middle trunks posterior, lower trunks posterior and upper trunks posterior. So the three posterior forms the posterior cord, and the anterior division of lower trunk forms the medial cord. The lateral cord, medial cord and posterior cord forms, and it branches. So this is a diagrammatic way how the brachial plexus are formed. And see, this is a dissection pic which I have got. So these are the roots, these are the trunks, superior, middle and inferior, where it divides into anterior and posterior. These are the divisions, and these are the cords, and these are the branches. Next, coming to branches. These brachial plexus forms many branches which supplies to many muscles. So now lateral cord have lateral pectoral nerve, lateral root of median and muscular cutaneous nerves, and medial cord forms medial pectoral, medial root of median nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm and ulnar nerve, and posterior cord forms upper subscapular, thoracodorsal and lower subscapular. See here, it's very easy. The lateral, all the lateral forms, lateral nerves forms the branches of lateral cord, whereas the medial or the nerves of medial cord. And see this ulnar, as we know from the beginning that ulnar is on medial side. The medial side nerve is called as ulnar nerve. So the medial cord branch is the ulnar nerve. Next, posterior cord. These are the posterior cord. Now coming to branches of roots. So actually the roots also have some branches such as dorsoscapular nerve to subclavius and long thoracic nerve. I'll show you the diagram. So this, see here, these are the branches of roots. This is the long thoracic nerve and this is the subclavius, and see here, dorsoscapular nerve to subclavius and long thoracic nerve. These are the branches of roots. And from the trunks, suprascapular nerve, which is from the upper, see here, this is the upper trunk. From upper trunk we can find the suprascapular nerve, subclavius. These are the branches. This is the branch of upper trunk. Now coming to clinicals. Coming to clinicals, now I will discuss about Erb's point. This Erb's point is nothing but it is a junction of nerves which are formed by the C5, C6, suprascapular nerve and nerve to subclavius, anterior and posterior division of the upper trunk. This point is called as Erb's point, where the six nerves forms a junction. This is called as Erb's point. So any damage to this point causes the Erb's paralysis, or called as Erb's palsy. See here, this is the upper trunk and this is the Erb's point, where these six nerves, the 1, 2, 3, 4, 5, 6, all these forms the point. This is called Erb's palsy. See here, coming to cause of injury, Erb's palsy. This Erb's palsy is mostly occur due to the forceful suppression of head from the shoulder during the birth. So you can see in this pic where the doctor is during delivery, while removing the baby from the mother's womb. So any forceful action at this point can cause the Erb's palsy. So what are the deformities of Erb's palsy? Here the arm hangs by side, which is nothing but adducted, and it is medially rotated. Arm forms this, whereas the elbow is extended and pronated. So you can see here in this pic, where here the forearm is extended and pronated, whereas the arm hangs by side, adducted and medially rotated. So this is also called as policeman's tip or water tip hand. So this is one of the clinical anatomy, or one of the clinicals of any damage to brachial plexus. Next, coming to another, that is clumpix plasia. This is due to the lower trunk damage, and it is site of injury is lower trunk. Medial cord is also involved in this, and it is also caused during the birth injury or any damage to cervical rib. Here the abduction of arm while holding something with hand. See here, he is something holding. Suddenly, when a sudden jerk happens at the lower trunk, it forms the clumpix plasia, and the deformities are claw hand. Here this is the claw hand in the pic. Here the long flexor fingers are unopposed, means unopposed actions of long flexor fingers and extensors, and paralysis of all the interosseous and middle two lumbar muscles happen. And this is the claw hand. This may be this is mostly affected by the medial two fingers are mostly affected in this. Thank you.